Well, me and the wife were just coming home from Redding, and we had met the ambulance in the canyon, and somebody had called and said that the kids had been in a wreck.
A car crashes off a rural Shasta County highway. Two little girls are airlifted to a hospital in Redding. We'll see how telemedicine, technology, and medical experts
Was she ejected from the car, or was it a prolonged extraction?
are teaming up
It's one of our protocol issues with kids with traumatic brain injury.
and saving lives.
I love you too much.
I've never seen my eardrum before.
Plus, how some employees are visiting their doctors from 3,000 miles away.
It's amazing that I can have a doctor in California taking care of me back here in Raleigh, North Carolina.
And seeing your doctor right from your own living room?
Kind of like the Jetsons, right? We're moving towards that stage. I see here in the next 5-10 years, you'd go on your computer and set up an appointment, see your physician live over video.
It's all next on Digital Doctors, the future of healthcare. You are looking at just one of the high-tech training rooms at the UC Davis Center for Virtual Care. This is where nurses, physicians, medical and trauma experts train to use telemedicine. It's really ground zero for saving lives and helping people, especially those who live in rural areas. Let's start with the story of a 3-year-old girl named Renee. Renee was in a car accident on a rural highway in Northern California. She needed emergency care, but was miles away from a big city hospital. Highway 299 in Shasta County, California, is a long, scenic journey that stretches through farmland and forest. Just east of Redding, it leads to the small town of Boerne, a quaint Northern California town. About 3,200 people live in this quiet wilderness community. It's miles away from big city life, a place where you won't find a big shopping mall, an auto mall, or perhaps most important, a big hospital.
Well, me and the wife were just coming home from Redding, and we had met the ambulance in the canyon, and we kind of thought, well, I hope we don't know anybody, and had that feeling. And as we were getting home, the helicopter was going over the house. And so from there, the wife went in and somebody had called and said that the kids had been in a wreck.
Early in the afternoon on August 3rd, 2010, two girls, 10 months and 3 years old, were in that car when family members say the driver lost control and rolled the car several times before ending up off the highway, inches away from this tree.
So basically, where the bush is up there, they left the road. I'm assuming it was around 100 miles an hour. That's what the speedometer was stuck at. Apparently he was trying to pass, I guess. Once he lost control, I believe the car got a little sideways, and then it started doing the barrel rolls to this tree here, and it broke it off. You see it standing up here. And then I guess it continued rolling to this point here, where we're at over here. Here's the safety belt that they cut off right here to free the baby out.
Both children were seriously injured and needed immediate emergency care. The crash happened in an extremely remote area of Shasta County, so a quick emergency response was crucial. But the nearest emergency room was more than 60 miles away. The girls were airlifted to Mercy Medical Hospital in Redding. 3-year-old Renee was in the worst condition. Her skull was crushed. A team of medical experts worked around the clock to save Renee. Her family didn't know if she was going to live, or if she survived, they didn't know if she'd be permanently disabled.
They said the chaplain was looking for the family to tell us, and they found some of the other family downstairs, I guess, and told her. They came in and let us know that she had a crushed skull.
Mercy Medical Hospital needed a pediatric physician to help treat Renee. But at the time of the accident, the hospital did not have one on staff.
We don't have all the subspecialty doctors available to us in this town, specifically with regards to pediatrics and pediatric surgery. So when a child comes to our institution, it's real important that we have some kind of linkage that we can help establish and continue care for those patients.
So Redding needed an outside doctor. They turned to the Pediatric Intensive Care Unit at UC Davis Medical Center in Sacramento. Dr. James Marson was asked to call in and help the team via telemedicine. Telemedicine treats patients over a distance by using telecommunications and technology. It put Dr. Marson face to face with Renee, the family, and the medical team. It was all captured on camera in the days following the crash.